All right, class, today we're going to cover bleeding control and shock management. If you want to follow along on your skill sheet, you can do so. At the very top is going to be bleeding control, shock management. All the information we're going to fill out for testing purposes. This is going to be your test sheet, the standard test sheet, all the equipment that's required, and scoring. And we have 9 procedures with 2 points per procedure possible, which is 18 possible points. You have to score 80%, which is 14 points or higher. That's going to be indicated on the critical criteria on the back of the page. First thing we're going to do is BSI PPE Penman. We're not going to cover that. That's covered under your other videos. First thing we want to do is locate the hemorrhage. So we'll say this is mid-forearm here. We located the hemorrhage. Now we need to figure out if it's arterial or venous. How do you know? Arterial is going to be bright red blood, and it's going to be spurting out or coming out of the wound in conjunction with the heartbeat. It's going to be much stronger than if it's venous. Venous bleed is going to be dark red blood, and it's going to be oozing out of that wound, okay? So here we're going to determine if it's going to be arterial or venous. You'll need to know that for your skills testing. We'll ask you the difference. You apply direct pressure to the wound with your gloved hand first because you need to control that bleeding, right? And elevate if possible. Continue the direct pressure and apply dressing. So I'm going to put my 4x4 gauze here, apply direct pressure and dressing. Now I'm going to secure the gauze to the patient. So I'm going to get my gauze. I'm going to start securing the gauze to the patient, wrap it around like so. You can also create a pressure dressing if you need to. So as you're coming around, every time you go over the wound, you make a twist. So it creates that little pressure. Every other time you want to create that twist, and it's going to create that pressure dressing right over that wound. Just like that. All right. So what if bleeding is still not controlled? You secure the wound here. There you go. Bleeding is still not controlled. What do? Well, if bleeding is not controlled, you're going to apply a tourniquet. Tourniquet, there's all kinds of different tourniquets. Here we're going to use a CAT, Combat Application Tourniquet. Pull this red tab all the way out until all the Velcro is out. That's going to leave you with a loop right here. We're going to place this tourniquet 1 to 2 inches above the wound, but not on a joint. It's not going to work on a joint because blood could still get through that, right? So if this mid-forearm, I'm going to go 1 to 2 inches above it. I'm going to place this over the patient's arm. Place the patient's arm through it. I'm going to tighten it as much as I can, 1 to 2 inches above, but not on a joint. Secure the Velcro. Now I'm ready to tighten this Velcro. I'm going to turn this, not the Velcro, but the tourniquet. Turn this, creating pressure until the bleeding is controlled. So I'm going to keep applying this until bleeding is controlled. We'll say it's controlled. I'm going to hook it into the loop right here. This nylon piece right here goes over it, and it's going to say time. So I want to document the time of application, date, and my initials on who placed the tourniquet. So bleeding is now controlled. Now that bleeding controlled, we need to monitor this person for shock. Because what happens with massive bleeding? Hypovolemic shock, right? So you'll need to know for testing purposes the signs and symptoms of shock. For instance, increased heart rate, increased respirations, nausea, vomiting, pale, cool, clammy skin, decreased blood pressure, which is a later sign, altered mental status, also a later sign, and loss of consciousness, which is also a later sign. Now I need to treat for shock. Place the patient on appropriate oxygen therapy, put a blanket over the patient to retain the heat and prevent heat loss, and properly position the patient for shock management, which is going to be supine. So first thing I want to do is get my oxygen tank, make sure I get a non-rebreather mask, place the tubing on the O2 tank, 12 to 15 liters. I'm going to put it at 12 liters right now. Pre-fill the reservoir and apply this oxygen mask to the patients. Like so, and if you want to, you can cinch the straps here for a snug fit. And there you go. And then I'm going to apply the blanket to retain heat for the patient. So now properly place the position for shock, which is going to be supine on a gurney and then transport immediately.